So today I'm going to touch on a little bit about how I got into surgery and what I love about it so much. I didn't grow up wanting to be a doctor or a surgeon. This kind of came across somewhere maybe around 1998, 1999 when I was an undergrad at Morehouse College. My undergraduate major was actually English. I had no plans to be in medicine at all, and I got somewhere in my junior year, I got a calling, spiritual calling, I believe, and I felt like it was leading me to drop English and become a surgeon, which is kind of uncanny. You know, obviously I was pretty much almost done with my major. I wasn't pre-med, so I had to go back and learn all the pre-med courses so I could go to medical school. You know, this is somewhere between 2000 and 2001. I was living here in Atlanta. I was actually teaching at Tri-Cities High School. I was a 9th grade biology teacher for about 3 or 4 months. Started as a substitute before I went to medical school. Somewhere in there, I just got this bug to become a surgeon and go study science and go to medical school. There's a quote that's, I think it's widely attributed to Hippocrates, where he says, "War is the only proper training ground for a surgeon." I can definitely see that as I've started to practice and gotten into it. There are a lot of similarities between surgery and war. Number one being, you have to have a strategy for surgeries. I touched on it in a prior episode. I always try to look at the anatomy, I look at what the patient is asking for, and I try to develop a strategy on how to execute that. Another way that surgery is like war is that, you know, you have to know the terrain, you know, which is like really having a good, thorough understanding of anatomy, what things you can do, what things you can't do. You know, you got to pick your battles as well. You know, not everybody's a candidate for surgery. I'm very forthright about when I think I can't help a patient with my skills, or if there's not a way that I can make their goal come to fruition. I'm always very forthright. And I think in surgery, it's important to turn down patients that are not appropriate and to take ones that are. And that judgment doesn't come right away. As I've gotten into my field further, I've decided, you know, I want all of my results to look natural. So I don't take patients if they have an expectation that their result is not going to look natural. The other way it's like war is that you have to minimize casualties, which is, you know, complications. So again, that comes back to constantly reading, brushing up on your skills. I go to courses all the time. I went to, I think, 2 this year. And in 2024, my goal is to start going international. There's a few surgeons that I want to visit with across the world, spend some time with, see if I can rub shoulders and pick up some new techniques. And then obviously just having a good sense of leadership. You know, war is about having good leadership. And, you know, when you're leading a team or you're leading a crew in the operating room, you have to have a sense of your voice so that you can communicate to people what you need and how they can help you to pull things together so that you guys can work as a team and get the job done. So I certainly look at it as not just a job, but as a calling. As I said, I don't approach this craft with anything but the utmost seriousness and professionalism. You're only as good as your last surgery in this field. Things can go south. We've all, you know, had complications. As surgeons, we all have surgeries or procedures that we would like to have back that don't go ideally. So it's a constant process of learning from your losses. So if you have a loss, you know, you have to pick up the actionable intelligence from that and make it a part of your craft going forward. And so that's what I do. I examine every surgery that I do. Even after it's done, I still go back and look at my old before and afters, try to find ways I can improve. I got trained by some excellent surgeons all over the country, different institutions that I went. They're all a part of what I do now. They're kind of like Luke Skywalker and Obi-Wan Kenobi. You know, they're kind of like elders to me now. I still read their articles. I still attend courses that they throw or that they put on. I'm in love with this profession, and I can't wait to continue to grow this year. Like I said, I'm planning to get out more internationally and try to learn from people in other countries that are specific in certain things that I want to get better at. So I'm just looking forward to sharing the next phase of my work with you all. I think my best transformations are ahead of me, and I can't wait to have you guys see it and be a part of it. Make sure you continue to follow our journey. We're going to continue to bring you content to try to demystify this profession. If there are certain things that you want me to cover or discuss, then please make sure you drop that and put a comment. Again, you can find me at AaronFletcherMD.com. Instagram, I'm at AaronFletcherMD. My educational page is Dr.KnowsBetter on Instagram, and we're also on YouTube and LinkedIn, and make sure you check us out and continue to follow the journey. Peace.